Good morning, everyone. Thank you so much for joining us today. We are waiting on a few more participants to join us. Thank you for your patience. We'll get started here in a few minutes. Hello, everyone. We are waiting for just a few more participants to join us here on Zoom. We will get started here shortly. Thank you again for your patience.
Hi everyone, thank you for holding. Commissioners, I'm going to now turn on your ability to start your video and audio.
Well, good morning, everybody. Let's give you a couple of seconds to present yourselves. Sean, of course, in a beautifully striped tie. No surprise there. So just by way of explanation, it turns out that Ethan has internet. I was going to tell everybody that you didn't, and so I'm glad that you have internet. Tamar has internet. Just so you know, sometimes these meetings are like weddings. If you're a participant, everything looks fantastic. The music is great. The timing is perfect. Not a problem in the world. But it was only 2 to 3 minutes ago where neither Ethan or Tamar had internet. So we thought they were going to have to do this on the phone. It's kind of like flying an airplane with newspapers over the windshield and just to work on the instruments. But I see that you've managed to resolve any kind of difficulty we might have been confronted with. I was ready to name a new executive director, but I guess we don't have to do that now.
Well, you may want to anyway, Mr. Chairman, but we are here and ready to go. So. All
right, so I'm going to turn it over to you, unless you want it. If you have any preliminary remarks to make, if not, I'll start with my opening statement.
I think we're ready to go, Mr. Chairman. I know the first witness is on, and so please go ahead.
Great. Well, let me welcome everybody to the September 24th, 2020 meeting, our public hearing on the public-private partnerships in the state's response to the pandemic-induced recession. My name is Pedro Nava. I'm the chairman of the Little Hoover Commission. I thank you all for joining us today. I want to introduce the other commissioners who are here with us. Joining us today as our vice chair, Sean Varner, Commissioners Dion Aroner, David Byer, Cynthia Buiza, Bill Emerson, Kathy Schramberger, and Janet Sidley. We're also joined by Assemblymember Bill Quirk. Welcome, Assemblymember. Good to see you again. Also with us is our commission staff, Executive Director Ethan Rarick, Deputy Executive Director Tamar Foster, Project Managers Crystal Beckham and Tristan Stein, and Analysts Sherry McAllister, Ashley Hurley, and Rachel Mattioli. Let me do a little bit of housekeeping as is customary. The commissioner's audio and video will be turned on throughout the duration of the hearing. Commissioners, you may mute yourself if you wish. Remember to unmute yourself if you want to make a comment or ask a question during the hearing. As is my practice, I'll look to the screen to see who has been unmuted, because that usually indicates that the commissioner wants to make a comment or participate. The video and audio of our hearing witnesses will be turned on when it is their opportunity to speak. Members of the public will be muted during the hearing. As a standard for the commission, we'll have a public comment session at the end. Those who wish to make a comment will be unmuted during the public comment session. If you'd like to make a public comment, please use the raise hand feature in Zoom by clicking on the hand icon to join the public comment queue. Now, there may be those who have joined us by phone. You can send an email to littlehoover@lhc.ca.gov indicating you want to address the commission. And there you have hand, the graphic showing the hand, and you also have the email address if you are joining by phone. You must provide the phone number from which you have joined the meeting so our staff knows who to unmute. Staff will be monitoring raised hands and emails requesting comment throughout the duration of our hearing. As is usual at commission hearings, public comment is limited to 3 minutes per speaker. We are recording today's hearing, and after the meeting, staff will place a permanent link to the recording on our website and upload it to our YouTube channel. And now to the substance of our hearing. This is the second of 2 commission hearings on the role of public-private partnerships in California's response to the pandemic-induced economic recession. In the previous hearings, the commission heard about the severe impact of COVID on small businesses and about how the public and private sectors can work together to help California's small business survive and recover. Today's hearing will focus on how public-private partnerships can also support job training and reskilling opportunities for Californians who have lost their jobs as a result of the pandemic. COVID has had a severe impact on working Californians. The pandemic and pandemic-induced recession have left millions of Californians unemployed. About 3 million Californians are currently are on or seeking unemployment insurance. The pandemic's impact, however, has tended to be most severe on lower wage workers. It is probable that many of the jobs that have been lost will be slow in coming back. Some of these jobs may never return. Surveys of corporate executives suggest that up to half of companies nationally are responding to the pandemic by increasing their investment in automation or are planning to do so. At the same time, the pandemic and its effect on workplaces is also driving demand for new career skills. As a result, workers who have lost their jobs because of COVID may need to learn new skills or train for new careers in order to secure employment. Job training programs, reskilling opportunities, and workforce development services are likely to be crucial for helping these Californians find new jobs. In addition, training and reskilling can potentially also help them access higher quality jobs. Successfully reskilling workers and helping them move into high quality jobs may, however, require new approaches to job training. Although California has invested heavily in career education and workforce development since the Great Recession, levels of coordination between employers and training providers can vary significantly. It can also be difficult for workers to determine what training programs are available and which are best suited for them. Consequently, more robust partnership among the state of California, employers, training providers, as well as labor and community groups will likely be needed to meet the training and reskilling needs of workers impacted by COVID. Today, we will hear how California can support job training and reskilling opportunities. We will learn about innovative approaches to job training that feature high levels of coordination and partnership between the public and private sectors. We will also see how California can foster collaboration among employers, labor, and educational institutions to strengthen and expand pathways to employment for Californians impacted by COVID-19. We anticipate making recommendations in the months to come about ways the state can encourage and sustain greater public-private partnership in promoting equitable recovery. We don't want it to be just like before. We want it to be better. And let me, before I go to Tristan, just let me express my appreciation to staff again for an extraordinary memo outlining, I'm going to kill my phone, outlining the issue, the participants, the investment, and approaches that we can explore moving forward. Now, I want to ask the project manager for this hearing, Tristan Stein, to please introduce the first witness.
Mr. Chairman, Pedro?
Yes.
It's David Byer.
Yes.
I want to second what you said about the staff. I hope that the witnesses and the public recognize that the commissioners are the beneficiaries of excellent background work by the staff. So if we ask less than precise questions, it's on us, it's not on the staff.
Thank you, Commissioner Beyer. Well said. Tristan, your turn.
Thank you, Chairman Nava. Our first witness this morning is Debbie Yaddow. Ms. Yaddow is Senior Director of Pathways at Futuro Health, a nonprofit that supports training and retraining in the allied healthcare fields. Ms. Yaddow has 37 years of nursing experience in both clinical settings and in higher education instruction and administration. Ms. Yaddow has served as Dean of Allied Health and Nursing at Grossmont College for 10 years. And prior to that, she taught in Grossmont College's nursing program for an additional 10 years. Ms. Yaddow earned both her master's degree in nursing administration and her Bachelor of Science in Nursing from the University of San Diego. Ms. Yaddow, please.
Hello, Ms. Yaddow. I'm going to interrupt you.
Sure.
Only because, and I failed to explain this initially. You may find that during the course of your testimony, you're going to be interrupted by commissioners asking questions. That should be taken, and the other witnesses should keep this in mind. It really is a compliment. It means that we've looked at the material, we're familiar with what it is that you've provided to us, and it has already prompted some questions. So please, if you find during your testimony that I'm acknowledging a commissioner to ask you a question, you should be flattered.
Thank you.
Of course.
I want to thank you, Mr. Chairman, and for the invitation to present to the commission today. Futuro Health was established with a $130 million commitment from Kaiser Permanente and SEIU UHW West. Our mission is to improve the health and wealth of communities by growing the largest network of credentialed allied health workers in the nation, starting in California. Our goal is to credential 10,000 workers by 2024. Who are allied health workers, one might ask? Paramedics, for example, you have to be transported to the hospital for a serious illness. Paramedics are an example of allied health workers. The lab technician that draws your blood, the radiology technician that takes your x-rays, the respiratory therapist, occupational therapist, orthopedic technicians are a few of the allied health workers. Typically, allied health workers are anyone with a sub-baccalaureate degree that provides direct patient care. Allied health workers make
Ms.
up—
Yaddow, if I could interrupt, Ms. Yaddow, I apologize, but I know that you did provide our staff with
Yes.
a PowerPoint presentation.
Yes.
Would you like us to go ahead and
Yeah.
put that PowerPoint on the screen?
That would be wonderful. I was hoping you would. Thank you, Mr. Chairman.
So Rachel, if you can go ahead and do that. And commissioners, I'll also note that I emailed you the PowerPoint slides last night, so you have those as well. But Rachel will be advancing the slides. And Ms. Yaddow, just let us know what slide you'd like us to go to. And then if you'll just tell us when you want us to advance them.
I sure will.
Thank
you. I'd like to go to slide 3, if I could, Rachel. There we go. Allied health workers make up about 60% of the workforce in healthcare. And like I previously mentioned, these are typically sub-baccalaureate individuals that provide direct patient care. Next slide, please. In comes Futuro Health. Futuro Health invests in the education and training of individuals for allied health programs. Our goal is to provide better paying jobs for folks, ultimately better patient outcomes with the excellent training they will get, and better employees. Next slide. And to do that, we've taken a different approach. We have taken an ecosystem model. We've developed an ecosystem with partners with the public, private, and nonprofit sectors. We select those educational partners, that is part of my role, bring together support for students along their educational journey, and have done all of this at scale data science. What does the ecosystem model do? It provides the model itself is very flexible. For example, next slide. In March of this year, we developed COVID-19 training in a 3-week period. We served over 3,500 employers and employees and students to date. We have heard loud and clear during the pandemic that telehealth is here to stay. And we have reached out and partnered with the University of Delaware to create an advanced telehealth coordinator certificate program, which launched this week. We've also partnered with Coursera and Johns Hopkins University to launch Health IT, and our first course begins November 16th of this year. Next slide, please. What are some advantages of an ecosystem? Flexibility is key to an ecosystem. When we see labor market needs, the ecosystem can change. We currently are working with 6 accredited institutions of higher education to put over 1,000 medical assistants into programs due to labor market demand. Next slide, please. When you send volume to these institutions like we do, because we are at scale with Futuro Health, it makes them more flexible in their ability to evolve the curriculum. The ecosystem model also allows us to source programs around the nation, which is very beneficial to serve the needs of our students and our employers. Next slide. Through this model, we are reshaping career training and reskilling by determining what's in demand. In addition, we negotiate preferred partner rates and pricing with our educational institutions. Next slide. Now, what are some disadvantages of an ecosystem? Well, certainly some say an ecosystem is slow to form. But what we have found is once we have formed an ecosystem, the agility really outweighs the slow formation. Next slide. We all know that there are tremendous challenges facing colleges in California. We know that state budgets are shrinking drastically. But with the Futuro Health model, we can offer a workforce model where students, employers, and unions can keep up with the needs of the employer and ultimately better serve students for the future of work. Next slide, please. We know that by working together, we can create an opportunity. And with that, I can take your questions. Thank you.
Thank you very much. Do you have, let's see, we have questions from commissioners. Commissioner Byer is unmuted. Does that mean you've got something?
Sure. That wouldn't surprise you, would it?
No, no.
Thank you for fantastic testimony. And I think you anticipated several of the questions that I have. And going back to the chairman's comments in the beginning, there's a theme in our hearings on COVID-19 that is leverage. And so I want to focus on that, and I want to focus on the question of scale. It's clear the state has a budget deficit. And so if you were to have a minute with the governor, there are basically 3 things that you could conceivably talk about. More money, better administration of job training, or better partnerships. And I think your answer is let's focus on partnerships as opposed to moving the deck chairs on the state government side of different councils and commissions and boards and all that. As one of my fellow commissioners, Sean Varner, put it, quoting somebody, it's a Rube Goldberg scheme. And what you focused on is how do you get things actually done? And 10,000 students, that's a lot. It's not enough for the state, but it's a lot better than 300. So my question is, how do we get large and medium and small employers to leverage their balance sheet to do more training? That is, what tools could the state legislature use in the form of incentives, either preference in contracting to people who do more training, tax credits, other things that the state could do to increase private sector spending on training. You must deal with lots of hospitals and doctors' offices and the like. How do you convince them the money for training is worth it because they're going to get more productive, happier workers who are going to produce more income for the business?
Well, Commissioner, that's a great question. And one of the things that I will say that we have done is we have worked with public and privates. And typically when you mention a private university, you think, oh my God, the cost is outrageous. But one of the things that we have done is we have developed a preferred partnership rate, which I talked about. Many of the public and private sector courses that are designed to train workers are not as nimble as they need to be. And so I think that when we have the ability to go to scale and say, we will send you 1,000 students over the course of a period of time, then their ability to transition to what we really need to make flexible, outstanding allied health workers is absolutely more present. One of the other things I just want to say about education in California, especially within the community colleges, is that the community college educational system is not nimble at all. If you want to develop additional training, you have to go through a year process or longer through the chancellor's office with the community colleges to get that curriculum approved. The other thing that we don't see in community colleges that would be very helpful is competency-based education. In other words, credit for prior learning. I think that's really important. And you see that in private universities, that students that come in with prior experience are given credit. They can test out of a particular aspect of the curriculum based on their education and experience. I think that's an important aspect as well. So while we see, tremendous gaps in California in terms of their willingness to sort of think outside the box, I think that with companies like we are partnering with, the ability to say, we can do this to scale. And because of that, they're more willing and flexible to work with us. I think that's an advantage that we have. The other thing I want to say is that in healthcare, soft skills is critical. And I have interviewed probably close to 100 or more of the clinics throughout California, the federally funded clinics, where a lot of medical assistants work, for example. And these folks, the biggest complaint they have is they have the skills, but their soft skills are not there. So we're investing likely $1 million investment when all is said and done into what's called human touch healthcare to provide an immersive experience for students so that when they come out, they haven't just checked a box off. I've done my soft skills, I'm done, but they're changed and they're better employees. And because of that, patient outcomes will be better. I hope that answered your question.
Yeah, that's great. And I appreciate especially your focus on certification. That is the Google, Microsoft, not to demean the qualification, but it's a lot like a job merit badge. You go through a training, it's highly relevant to the employer, and it doesn't take 4 years, and it's not that expensive, and you can do a lot of it online. One last question, and then I'll defer to my colleagues. Help me understand better the role of organized labor as a partner, because it seems as though, particularly in health, and California Nursing Association is a clearly important player in all of this. How do they help and how do they hinder the training program for allied health workers?
That's a great question. So I think that the way in which they help, I can just touch base on our partnership with SEIU UHW. They are the recruitment machine for us. These are the folks that go out and recruit friends and family and to our programs. So they provide recruitment. How do they hinder? I think that they're a big organization. They're like the Titanic, and to pivot and turn is not always easy for them. So I think organized labor has that element of being able to identify what key stakeholders are out there, what is it their needs are in terms of employees. And then the disadvantage would be that in order to sort of pivot and recruit multiple sort of allied health disciplines sometimes can be very challenging for them.
Thank you.
Thank you.
I see Assembly Member Quirk is unmuted.
Yes, thank you. I'm on the Rev and Tax Committee, and you have to, the commissioner mentioned that perhaps we could make some sort of a tax break for people who do training. Tax breaks are about the worst way to incentivize people to do things. First of all, if it's a deduction, the people who make the most money get the biggest benefit. And you, of course, would want it to be the other way around. If it's a refundable tax credit, the problem is you never know when you're rewarding people for something they would have done already, as opposed to encouraging. So just to say that it's much better to have a grant program, or if you are going to have a tax credit, well, that's problematic because this group may not be able to, may not be able to pay taxes. They may not be making that much money. So it's much better to have a grant program for something like this than it is to have tax credits or tax deductions. Thank you.
Thank you. I see Mr. Bronner.
Morning. Thank you for your testimony. I had just a couple questions that I'll just put them all out there, and then if you can answer one. I'm curious about the relationship with Kaiser having provided that grant, and whether there's some preferential treatment that Kaiser gets with that, or trainees if they go to work with Kaiser. And then following up on Commissioner Byers' question with regard to the unions, I know that there's some movement out there by some of the larger companies. I don't know how COVID has impacted this, to have some private healthcare facilities on their campuses. And it seems like this would be a great program for some of those private providers that are doing that. I think there's one called Crossover Health that's doing that quite a bit. And then I'm curious about the average salary for these allied healthcare workers. And I know we've talked about a higher middle income type of wage, so I'm curious about what that salary is. And then finally, during training, if these are part-time training processes, or if it's full-time, and what kind of income the trainees receive during the training, whether they're getting, when you do this hands-on experience, whether that's paid internships or they're unpaid.
So let me address the first question in terms of the Kaiser relationship. So Kaiser was one of the beneficiaries that actually funded us in terms of the $130 million along with SEIU UHW. Kaiser does take trainees in their facilities, and they have done so for a long time. It's really no different. Do our students get preferential treatment? The answer is really no. We partner with the school, and the schools have relationships with many hospitals throughout California, such as Kaiser, such as Dignity Health, such as Sutter, and then the private clinics. So while if we were in a pinch, could we call upon Kaiser? I'm sure we could. But Futuro Health does not do the placement of these students. The educational institution does that. So there's really no preferential treatment other than the outstanding relationship they currently have with the educational providers. In terms of salary, I just wanted to address that. So we see the entry-level medical assistant as a stepping stone, a career ladder. It's not the beginning and the end. It's simply the beginning. And so while you might make $45,000, which is probably not enough to live in California as a medical assistant, if you're in a unionized facility, you can make much more than that. However, not all hospitals are union. So, but we see it as a stepping stone. So in terms of future opportunities for students, we don't want them to stop at a medical assistant because the salary is not necessarily something you could live and grow on in California. Now, if you're a respiratory therapist or a cardiovascular technician, you can make close to 6 figures depending upon your education and the particular institution you're employed in. So I have worked with cardiovascular technicians in my dean position that were making $96,000 or more. And respiratory therapists, the same. You can make high 80s, and depending on your education and experience, even more than that. So I think that, you know, certainly it depends on the allied health profession that you're examining in terms of salary. But for medical assistants, which we started with because there's a tremendous need in California, It's not the end, it's just the beginning for those folks. And then if I could answer your question on part of full-time, we have made all of our programs adult user-friendly. And what that means is that they are doing, because of COVID, all of the colleges have gone to an online or hybrid format. For training in allied health, there's a certain degree of practice skill that you learn that you have to do. That can't be done virtually. So most of the programs offer an online hybrid format. So they're online for 4 or 5 days a week, and they spend 1 day a week in a lab practicing the skills that they've learned. With COVID, we've had to, the numbers are much smaller. You can't put a group of 30 students in a lab. You have to space people out and follow all of the CDC guidelines. So students might have to spend 2 half days, for example, just to spread out the number of students. But these are really designed for adult learners. And do they get paid? The answer to that is, are there, paid externships? Right now, the answer is no, and simply because many of these accrediting bodies don't allow apprenticeship programs at the same time. And so for that reason, most of these folks, they know in advance that toward the end of their training, they're going to have to do a full-time 4-week opportunity in a health clinic or a hospital, and hopefully they can plan for that in terms of their employer. We have found, interestingly, that many employers are pretty flexible because they want to see their employees improve. They want to see them grow. While that's not true of everyone, but it is true of many of our employers. In fact, I think it's interesting to note that during this time, I've heard of only 2 students that have had to quit their job because they couldn't get the time off at the end. So I hope that answered your questions.
I see Commissioner Aroner is unmuted.
Right. I want to thank you so much for the testimony. It really is interesting. I want to follow up on this issue where you mentioned that there doesn't seem to be a link with apprenticeship programs. Why is that? Because SEIU is involved in apprenticeship programs in other sectors. And so I'm just interested in what's the holdup there, from your perspective.
Yes, that's a great question. So what we have learned, depending on the education's accrediting body, and all of these programs are accredited programs. We don't want to send somebody to something that's not accredited because the quality is not there. Many of them feel that it's a conflict of interest for students. And so because of that, they've been very reluctant. Now, that's not to say apprenticeship programs can't happen, but with the current partners we have right now, and we're growing, just so you know, we're growing, we're going to have more. We see that as a model in the future. One of the things we're looking at, just to let you know, is we're looking at, do we stipend, for example, a worker during their externship experience, during that 4-week? So we're looking at opportunities such as that. Our MAs just now started their medical assistant program, which is typically a 10 to 11 month program. So we have time to sort of solve that solution coming forward to where the last 4 weeks of their experience, they will have to do an internship or an externship experience. So, yes.
Thank you.
Yeah, I have a question. I'm looking. Okay. In your written presentation, you're talking about in our 9th month of existence, we're on track to move 1,500 students across the state into education programs where they can become medical assistants, health IT specialists, care coordinators, and telehealth coordinators. And you did explain that the selection is performed by your labor partner.
Yes.
Right. So my question is, what do you have built in so that you will ensure that there's appropriate diversity in the selection?
Well, first of all, just so you know, we have an extremely diverse group of students. They are predominantly female, white. They are not predominantly white, predominantly African-American, Hispanic. So diversity is a very, it's part of our mission, okay? It really is. And so we look at things through a diversity lens. Our data scientists at Futuro Health do disproportionate impact to make sure that we don't have any, because that's very important to us. So I think that because our pool is so diverse, we haven't faced that problem yet, really. We really have not. But that's a lens that we hold very dear to our hearts, just so you know.
Yeah, well, that's good to hear. Thank you very much.
Yes.
Do we, Mr. Emerson?
Yeah. Thank you for your testimony. I appreciate it very much. I'd like to drill down. You mentioned the fact that you're expanding. Are you expanding the partnership between other healthcare systems, hospitals and healthcare systems in SEI, UHW? And what is the percentage of funding that comes from Kaiser versus SEIU UHW?
That's a great question, and one that I apologize I can't answer. I just know that the gift came, the commitment came from both of them, so I'm not sure what percentage did what. In terms of expanding partnerships, when I say that, I mean educational partnerships for education and training. That's the expansion that we look to do. As we develop more programs for 2021, we're going to need additional education partners, because not every educational institution has the programs we're going to be looking at in 2021. So that's what I mean by expanding our partners. Okay. Yeah.
All right. Thank you very much.
Thank you. Any other commissioners wish to either make a comment or ask Ms. Yaddow questions? All right, seeing none. Let me take this opportunity to thank you very much for the information and your presentation today. I think it's going to be very, very helpful, because what we realize, and you know, I'm old enough to have been involved in the CETA program, the Comprehensive Employment Training Act. And CETA had a number of things that were intended to encourage this connection between the private sector and the public sector, private industry councils. But I think part of what you've helped to identify is that some of the larger entities are not going to be able to continue to do business as usual.
Correct.
There is a flexibility that is required in order to keep up with the sorts of changes that we're being presented with, both because of advances in technology, as well as because of the crisis that's brought about by COVID. So there are models that I think that we as a commission are going to have to look at and advance that that compel institutions that have been doing business as usual, so that they understand they can't continue to do business as usual. It's a different world.
It is.
And I think the model that you have presented gives some direction on how stuff is going to have to be done moving forward. So thank you.
You're welcome. Thank you, Mr. Chairman.
You're very welcome. Where is our Tristan? There you go. You move around in the screen and I got to go find you. So if you would be so kind as to introduce the next witness.
Thank you, Mr. Chairman. Our next two witnesses who will be our next two witnesses will be testifying together and are both from Jobs for the Future. Bertha Gutierrez is a senior director at Jobs for the Future, where she leads JFF's Inclusive Regional Economic Development Unit and examines how cities and regions can lead the way in establishing equitable systems that lead to economic mobility. Ms. Gutierrez has spent her career working across systems in education, nonprofits, government, and politics. In addition to a 14-year career teaching at a public high school and at a community college, she has held leadership positions on a nonprofit board of directors and as a city elected official. Ms. Gutierrez has a bachelor's degree in molecular and cell biology and in English literature from the University of California, Berkeley, and has master's degrees from Sciences Po in France and from National University. Joining Ms. Gutierrez in her testimony will be Allison Schmidt. Ms. Schmidt is a senior program manager at Jobs for the Future. In this role, Ms. Schmidt works closely with K-16 education, industry, and community partners across California to drive systems-level transformation in areas such as jobs quality, worker power, upskilling, and worker-based learning. Before joining JFF, Ms. Schmidt served as the Director of Financial Analysis at Renew Schools, a nonprofit charter school network in New Orleans. Ms. Schmidt has a bachelor's degree in economics from the University of Pennsylvania's Wharton School and a master's degree from UC Berkeley's Goldman School of Public Policy. Ms. Gutierrez and Ms. Schmidt, please.
And before you start, I just want to express my appreciation to staff for their work in identifying such extraordinary witnesses that we have on these panels today. Your background, your history, and what you bring to this conversation, we wouldn't be able to raise enough money to pay you to do this. But you've been so gracious to volunteer and to bring this to us. I just want to tell you thank you so very much. And then again to staff, thank you for such extraordinary work. Please, and sorry for the interruption.
Thank you so much, Mr. Chairman and commissioners. Good morning. Thank you for providing us the opportunity to speak with you about how California can support greater public-private partnerships as we really push towards an equitable economic recovery. We have some slides, and if we can put them on and go to slide 2, please. And I'll give us a second here. Perfect. Yes, we go to the next slide, please. All right, thank you. JFF is a national nonprofit that drives change in the American workforce and education systems to achieve economic advancement for all. Our California office operates as JFF's Inclusive Regional Economic Development Unit, where we really work across sectors and systems to build equitable and resilient regional economies that everyone can contribute to and benefit from, regardless of who you are and where you live. We can go to the next slide, please. Our approach to inclusive economic development uses strategies that address 3 main contributing factors to existing education and economic equity gaps across regions. These are the place-based conditions, economic development, and education and training pipelines that are needed for communities to thrive. We believe that by strengthening regional economies through inclusive economic development, the state can increase regional economic competitiveness to create better jobs and create economic mobility opportunities for more Californians. And this is our overarching recommendation. For this hearing, we have chosen to focus on strategies for workforce transitions that can provide quality jobs and create rapid reskilling opportunities, while also fostering innovations to regional economies that are critical for increasing economic competitiveness. Recovery strategies must take into account the unique equity concerns that were already prevalent across California's multiple regional economies before COVID-19, and have since then only been magnified by the crisis. So we ask you to prioritize actions and interventions for vulnerable populations, largely immigrants and communities of color that have made up the essential workforce during the pandemic, as well as those that will be most significantly impacted by a loss of income. I'll go ahead and turn it over to my colleague, Alison, that'll share some of the strategies that we're presenting today.
Great, thanks, Anna. Can you hear me?
Mm-hmm.
Great. If you could go to the next slide, please. So our first strategy for California is to establish and expand partnerships between industry research and development departments, post-secondary education institutions, and training providers. To do this, we recommend that the state catalyze industry innovations through public-private partnerships that focus on R&D with higher education institutions. This strategy should include industry-led training partnerships needed across the supply chain of businesses for R&D industry cluster approaches, and provide upskilling and reskilling opportunities for displaced workers to align local workforce to labor market needs. To ensure equitable access to these training opportunities, regions need to incorporate inclusion in the process and outcomes of these strategies. This is an opportunity to increase high-road training partnerships and establish inclusive talent pipelines that are critical for economic growth and business expansion. We also recommend prioritizing workforce pilots that support the transition from occupation-based to skill or competency-based training, especially in training that leads to middle wage jobs. This looks like expanding training that incorporates ed tech, immersive technologies, and other workforce training innovations that can scale to meet the explosive growth in IT, cyber, and healthcare sectors. It also means redirecting existing CTE funding to scale training pipelines that provide workers with skills that are transferable to other sectors. So for instance, from logistics to manufacturing or hospitality to healthcare. We also recommend deploying new ways to recognize skills and competencies learned through work experience, military service, and new education and training platforms. To do this, the state can set educational policies like credit for prior learning, competency-based education, and the use of dynamic edtech platforms that create the conditions for districts to pilot new ways of capturing and delivering learning experiences. If you could go to the next slide, please. A second strategy for the state is to integrate investments in reskilling with investments in entrepreneurship, innovation, and small business dynamism to build more resilient regional economies. Dynamic economies with vibrant small business and startup ecosystems are less vulnerable to external economic shocks, which in turn protects workers against job loss and economic insecurity. In California, we know that 41% of small businesses are owned by people of color. Regional education systems can support local small business revitalization efforts by building and strengthening strategic partnerships in their communities, especially with those who are the most vulnerable. So we recommend the creation of entrepreneurship innovation centers. This could look like a partnership between educational institutions and a city or county to incubate entrepreneurship that solves community challenges and also makes a profit. They can co-sponsor projects targeted at meeting city needs relating to housing, environmental justice challenges, clean water access, homelessness, and other place-based conditions that impact educational outcomes and employment. We also recommend utilizing work study to support small businesses. Public colleges and universities can use a portion of existing work study programs to place students with local small businesses as part of local revitalization efforts. This would provide small businesses with critical staffing support that could connect to the Small Business Guarantee Program requirements and align with the student's educational coursework, providing a paid work-based learning opportunity. If you could go to the next slide, please, and I'll turn it back to Anna.
Thank you. The third strategy is one that is often overlooked, but critical to coordinate activities across multiple partnership networks. And that is to invest in a robust ecosystem of cross-sector partnerships to support the regional collaboration. The previous witness described a little bit of Futuro's efforts to do that with that eye on trying to create agility. Similarly, I think the state has a unique opportunity to establish the enabling conditions for these cross-sector partnerships to move quickly and in coordination with public systems. Public-private partnerships require that leaders and practitioners be able to work across sectors, systems, and in California, often across jurisdictions. Private sector partners often move away from partnering with public sector because they move at a much faster pace and require an adaptability to changing needs that present a challenge for public sector systems. Given the decentralized governance context in California, JFF has learned that there are important approaches to facilitate this type of work. First, cultivate cross-sector networks that support regional collaboration. Regions have many existing initiatives that can be better connected and coordinated to avoid duplication of activities and to streamline engagement with private industry partners. Second, promote systems leadership characteristics. Leaders working across systems and jurisdictions need new skills, new mindsets, new dispositions to help them navigate that complexity and be effective in their goals. Third, include community-based organizations as co-creators of the interventions and solutions needed for the problems they face. CBOs and grassroots organizations have deep knowledge about their communities and trusting relationships with them that have been developed over the course of years and in some instances decades. By partnering with CBOs, leaders have the opportunity to better learn about what is actually needed to remove the place-based conditions impacting education and economic outcomes, especially for communities of color. In sum, we see an incredible opportunity for the state to strengthen its regional economies through inclusive economic development. These efforts serve to increase regional economic competitiveness, create better jobs, and provide economic mobility opportunities for more Californians. On behalf of JFF, we want to thank you for giving us the opportunity to share some of what we have learned in our work. And with that, I'll turn it back over to you.
Thank you very much. Mr. Byer, you're unmuted.
Yes, thank you very much. First, with respect to Assemblyman Quirk, I agree with you about tax credits. I was using it as an example. Second, I'm very glad that strategy 2, outlined by our witnesses here, references the need to support small businesses. And I think it's actually very integrated with our earlier hearing about the Rebuild California Fund run by the iBank. So I think there's some synergisms here between training and finance. Also, earlier this week, the Governor's Commission on the Future of Work began a series of meetings on formulating their recommendations, and I'm hoping that you all have been in touch with them on their work and their recommendations. It seems like you are an expert in the field. But I want to go to a specific and blunt question. So leaving aside synergisms and other sort of magical words, what's wrong with the community college system in California, and how do we fix it?
I appreciate that question, and I'll go ahead and take this one, especially because I spent 7 years as a tenured faculty at California Community College, a time where I learned a lot, and I'll tell you that I would still be there. I loved that job. I loved what I did. Had it not been for some of the systemic barriers that kept recurring, and had it not been for, I think, where your question leads to, what is wrong? I think part of it is, and someone mentioned it, I believe it was the chairman, we have to move away from business as usual. And that is not just something that the community college system faces. That's something that is happening all over the public sector, and in some cases, the private sector. How do we move into a space where we can work differently, where we have different habits, mindsets, tech, and skills to be able to do this work? So I think that the previous witness talked about how long it takes to, let's say, create a CTE pathway or stand up an apprenticeship. I think when we think about those barriers of, how can we make the community college system more nimble? How can we get to that agility? I think it is about trying to push those partnerships from the outside that can actually enable the system to work differently. I think pilots are a big opportunity for us. The Community College Systems Chancellor's Office has been working on, and we've been supporting them in creating some competency-based education policy that would allow them to move away from business as usual, to try new things. And I think that while that's happening, and while we start pushing and fostering those transformations within the college system, they need a network of support. One of the pain points that constantly comes up and was something that came out of our research on the California Career Pathways Trust was really looking at, why couldn't you, with more resources, scale more career technical education pathways? Why couldn't you get stronger and deeper partnerships across the educational segments? One of the barriers that kept recurring for those partners were just the inability to have a centralized location for private sector employers, industry, to then navigate the complexity of the public sector system. But having that type of intermediary function is just non-existent for many public systems. And so as we push the community college and work with them to create these new ways, these proof points, we're gonna see more of those types of programmatic activities and the impact around, can we actually scale these pathways? Can we create these rapid reskilling opportunities? And we would argue that you cannot by just relying on one system, that it really does take an ecosystem and a network of partners and actors.
Thank you.
Thank you, Commissioner Sidley.
So my question is I work at the Port of Los Angeles, and so I certainly understand the difficulty with public-private partnerships. So my question is to drill down a little bit and ask you, what public relations, what avenues can we take to get more private partnerships, get more companies engaged with us? And also through your research, what would be the largest, lack of a better term, bureaucratic obstacles that we can suggest to the legislature to maybe change or be more flexible in order to engage and create what you're talking about in these networks to actually help solve for some of these problems that we have?
I can start on this one, Anna. So I guess when we're talking about this, this is something that we hear in every type of partnership with business. How do we get them invested? How do we get them engaged? How do we do this as not a, please help us in our work-based learning program or in our partnership, but actually have it be a strategic move for the companies. So, I can talk about a specific example in the Inland Empire right now. There is a bi-county economic development initiative called IEGO that is trying to pursue a cluster-based strategy in sustainable logistics and supply chain. So how do you transform that industry to actually benefit workers, to benefit the environment? And that's something where getting industry engaged is not just an ask to please help us support our training programs. It's really, it's a competitiveness factor for them. If they invest in these apprenticeships and training pipelines, that's going to help them succeed. That's going to help their bottom line. So I would say it always kind of comes back to that strategy for them and making sure it's really integrated with, a region's competitiveness.
Yeah, and to build off of what Allison's talking about, it's really the dual approach of, yes, we need the work-based learning and the training, and there's a real bottom line ROI for employers. But I think the second strategy that we sometimes overlook because we are so maybe supply side focused is also the benefit to employers in connecting with one of California's biggest assets, and that's our higher education research institutions. Because what we want to do is we want to work on creating these robust and inclusive talent pipelines. So the workforce component, as well as the research and innovation, and really moving our industries up the supply chain. Because when you're trying to, I think that the narrative, and this maybe is also back to that first question, the narrative that we tend to see is, hey, businesses, we need you to provide this, as opposed to what we're learning now, which is like, hey, businesses, there's a real opportunity for you to really move up the global value chain and really have more of those innovative products that are unimaginable just yet. But with these research opportunities, with this, and then you mentioned what can the government do? Sometimes it really is just casting that strategy and saying, this is important to us, and we are going to prioritize and resource being able to perform that intermediary function to get to seed these partnerships, to grow these partnerships. And when you have both of those value adds, it becomes less of, hey, employers, can you do this? I think the second thing that I'll name is, I think what California Career Pathways Trust, what that policy was trying to do was in the right direction. And that is, can we braid funding? Right? Can we not just say, hey, you guys figure it out, how do you coordinate your resources? But can we say, hey, we have learned that this would be better, your partnership would be better structured if you shared resources, if you had to go into it, right, with that partnership already in place. And so I do think that really looking at the public sector structures for funding that could facilitate this type of work and these types of partnerships will be really important, especially in terms of the regional coordination or any type of coordination that is needed across sectors. Because oftentimes the barrier is, who's on first, who's really driving this? Everyone has an agency or institution that is their primary concern. And then you ask them, okay, but we need to do this other thing because it's going to help your institution. That process needs to be resourced, coordinated and facilitated in order for you to get that agility, in order for you to be able to move more quickly, and frankly, remove a lot of the existing barriers that prevent private sector partners from having deeper partnerships with our education, training, or civic systems.
Yeah, Commissioner Sidley, yeah, go ahead. And next will be Commissioner Guiza. But
just a quick follow-up. What you're talking about seems to me maybe some sort of clearinghouse, some sort of repository of where everybody in the state has these programs, and there'd be a collector of this process or program or something where, you know, the schools or the businesses, and then you could make that match, and then you could create that synergy to build on each other. So somebody in Los Angeles and somebody in the Inland Empire and somebody doing work in a field in Central California, they could see where that synergy is with a university or state college, and they could all partner up. But if you had that clearinghouse of information, then it would be easier to make that network and create those opportunities, because then there'd be one place to look versus, you know, my website and you know, the city of LA, the county, and that's sort of too daunting to even begin with. Is that sort of what you're thinking? I see you shaking your head. Okay, yeah, good.
I would say yes, and then the support to actually work in these new ways. Because I think that's the biggest thing that we learned in the California Career Pathways Trust research, was that it was a really strong start, and what we saw were that people were starting to learn in how to work in new ways, but they just needed more time, they needed more support, and they needed that clearinghouse. That was one aspect of that, absolutely.
Thank you.
Commissioner Buisa and then Commissioner Aroner.
Thank you, Anna and Bertha, for the presentation, and also for really underscoring the fact that communities of color, and especially immigrant workers, have the greatest barriers to the training opportunities, among other things. I have two questions, and they're related. One is, do wraparound services to promote equitable access to training exist? Or is it something that the state needs to still be looking at? I say that because there's been research, as well as what the staff at the commission has come up with, that many communities of colors and immigrants face challenges in pursuing education and training due to high housing costs, transportation, and childcare barriers, right? So, for example, do you think about increasing funding for stipends and transportation and childcare for individuals? That's one question. The other is, since you mentioned CBOs, how do you work with them? Can you cite some examples? Because many CBOs have a disproportionate presence in underserved regions. And I know that the state has also started looking at the issue of regional disparities. So I'm just curious, how does your work permeate conditions in these areas where not a lot of infrastructure exists?
Great questions. I think on the first piece, I'll start with the wraparound supports. In California, in the community college system, one of the two largest barriers to educational success, really completing, are food insecurity and housing insecurity. So I would underscore that the answer would not be, can we have a provider that really takes care of all of that? I think that's part of what we've learned is, you know, regional work or partnership across jurisdiction, across agencies are what needed to create more of the system of support, as opposed to what we've seen a lot is, here's a center and we're gonna send you to it, and maybe, you know, and then lots of steps in terms of the resources. And there are some great one-stop shops in California that do a lot. And when we look at the characteristics of those like successful one-stop shops that are really aggressively providing wraparound supports, they're usually have multiple partnerships. They usually have partnerships with labor or the local community college districts, with a county or a public sector governmental actor. So I think that is one piece, is that we really need to think about for those large barriers that are really, we would call at JFF, the place-based conditions that impact opportunity. What is the role, I would say, not just of a provider of wraparound supports, but then of the other partners that are needed in order to do that systemically? And then secondly, how are we resourcing those organizations and agencies that are trying to provide that support? How are we, I mean, this really goes back to me, to the earlier piece around how do we braid funding from the get-go in order to encourage and facilitate the partnerships that are needed. I'm going to move to the question around CBOs, and you said some very, how do we work with them, and can we give you some examples? I think I'll name two. In the first example is really last summer we were part of the core consulting team supporting the Fresno Drive effort, which was really around how do we mobilize and build a 10-year investment plan for that really takes into account the inclusive economic development principles that we've been talking about today. And one of the most important pieces of that work was the role of community-based organizations, because what they were able to provide in a very technical way that I think is, that I would elevate, is they had deep neighborhood knowledge, data. They understood where the housing issues were concentrated. To your point about transportation, they had been thinking about this, working on this, collecting information for years, and had already mobilized existing campaigns that could then get elevated and draw more attention, actually be included in how that region was going to plan that 10-year development. And so I think that those were a couple pieces. And then I think the third piece that is often overlooked is the race and equity work. If you really want to create an inclusive economy, the race and equity work, the challenges that are, and the disproportionate impact that we've seen for decades in California cannot be addressed as we're going to make this plan and it's going to fix everything. It has to be co-designed. It has to be bringing folks into the partnership that are going to add value to the types of solutions you can create for your community. The last example I'll give of how we're working, how JFF is working with community-based organizations is around college success. We run a community engagement for college success network that is comprised of community-based organizations in the LA region, in the Inland Empire region, and in the Fresno region. And a lot of what that work has showed us was how important they are in being even able to say, these are the types of services that are needed. These are the priorities of the community. And even in some cases, really being able to say, the state systems are saying this is the problem, but we want to elevate that. Beyond that, we actually see this as a root cause. And when we start going to root cause, then we're actually able to do, I think, what we're all talking about, which is really transform our systems for the 21st century.
Yeah, thank you. Before we go to Dion Aaroner, I wanted to bring up, and Tamar may remember this, the points that you made about benefiting from community-based organization experiences were raised months ago when we had that meeting with the census outreach effort. Remember that, Tamar? When they were all talking about how the state of California wasn't going to go out, the state wasn't going to go pound on doors. They were going to partner with community-based organizations and communities because, and this was under Maribel Batcher's vision of it, they appreciated that the CBOs were going to know who the people were, where the people were, and what it was that they needed. And they had already established credibility with the folks who don't want anything to do with government. And it makes, I think, a tremendous difference. You already start ahead of the race. You don't start from back here. You start up here because you are relying on people that have been doing the work in the neighborhoods all along. And so, Commissioner Aaroner.
So thank you so much for this, for your presentation. So I was just thinking as I was listening to you all that, you know, the terminology that you use is very similar to terminology we've used in the health and human services world for a long time when we talk about integrating services and all of that kind of stuff. And so here you're integrating business, you're integrating people that have economic, right, you're driving the economy. And I guess I'm interested, and I like the idea of regionalization because the state doesn't have the contacts. The state's not the one who's talking to the community. Let's be clear here. It's happening locally. So the idea of regionalizations, and some people talk about 15 different regions in the state. Some people do it by county, and it all depends, right? All of that, I get that. But what I also have learned when we talk about integrated services is that you can't pick the leader. The leader comes indigenously from the community, and it might be, and it's different in every community, right? It's not, you know, at some point it's going to be some CBO leader who gets this idea, you know what, it's time to start talking to everybody because we're not working too well together. And somewhere else, for all I know, it's a priest who's recognizing that his flock is not doing so well when they come to church on Sunday or whatever, right? So I'm interested in hearing from you about how you're figuring, how you're helping communities figure that out, or because leaders pop up in different ways, okay? So that's the first thing I'm interested in. And then the second one, where you talk about weaving funding, had the experience over the years when we talked about integrated services, you bring everybody to the table. They've all got their own revenue source, okay? CBOs never have the same revenue sources that government has, to say the least, all right? And when you say to them, okay, let's grade the funding. So the idea being everybody put your money on the table, right? And then you have to pull your hands away now, because if we're going to weave funding, I can see Anna sitting here shaking her head. If you're gonna weave funding, you have to be willing to let go of using your money the way you thought it should be used, because there's going to be hopefully a consensus developed to say, we want to put a chunk over here, we want to put a chunk over there. So I'm interested in hearing how you see that working out in this ecosystem.
I love those questions because they speak to two things. I'll say that on the first piece around, you know, how do you find the leader? I think what we've learned is that all models are flawed, but some are useful. You know, there isn't a model for you need this type of CBO, you need that doesn't really work, because we've learned that you have to know your place. And maybe this is me being a teacher, you have to know your students before you know which educational tool to bring out. But I think it's similar in inclusive regional economic development. Regions organize not by jurisdiction, they organize by function, right? Not by geography often, but by what they're trying to do together. And I think that that means that, for example, in Fresno, there was a lot of work done through the Building Healthy Communities initiative. And the California Endowment had spent a decade investing in really grassroots community building around health outcomes. That work actually bled into the larger, what are we doing? How are we addressing these problems systemically as a region? So in that particular instance, there were already some infrastructure, right? I guess we would say in technical terms, but there was already groundswell. In other communities, the pace is very different, where now you're starting to see, I'll say in another region, you're starting to see the community-based organization ecosystem actually coalesce first with each other. And you're starting to see faith-based and environmental justice groups, as well as education advocates, starting to come together to understand how can we work as a coordinated voice, and then how do we actually, you know, what would it look like for us to partner more intentionally with our public sector systems? And so it really is, you know, it's not a model, but it is about making sure that you have a principle of inclusion in both the process and the outcome if you're really trying to see these changes. Now, your points about weaving funding, I mean, I think, and I was laughing because I had been in so many, I have facilitated so many conversations similar to what you described. And I think that's where I would rely on some of the research that has been helpful to us. And one comes from our regional work with the Irvine Foundation and work we did in terms of trying to increase the demand and supply of linked learning graduates. That is a high quality college and career pathway that starts in the high school system and goes through the colleges. And what we learned there is the only way, or I shouldn't say the only way, the best method of being able to facilitate that type of resource sharing was to find leaders who could be systems leaders. And there are 9 characteristics of systems leadership. And these characteristics really speak to what does it take when you're not the CEO, when you're actually working with a number of CEOs, you have no jurisdiction over them, but it really is about what is the mission that is bringing us together. And so there are 4 network collaboration principles that were really useful. I think the first one is it's about the mission and not the organization. And so you cannot get to that place without building trust. So, you know, the second principle was trust, not control. The third principle was really looking at, and I'm looking at my notes here to make sure that I'm getting them right, really also recognizing who is in the best position to lead at the moment. Sometimes it is not my agency, sometimes it's your agency, but our eye is on our mission. We are brought together and we are driven by our principles. And so setting that with community organizations that have a lot to say already and have a lot of credibility really does help keep the eye less on those short-term gains, but more on the long-term play. And then the last one is that you're really trying to build constellations, not stars. So it cannot be the old paradigm of here comes, you know, this leader and this leader is gonna mobilize everybody and change everything. But it's really now more about who are the leaders that have the dispositions to work with other people in order to see more of that impact. And that's a huge paradigm shift that I'll just name, but that we have seen through the research, you know, whether it's our research or other national research, are the characteristics of effective network collaborations and really getting to, I think, the heart of how do you actually increase public and private sector partnerships. You cannot do it with a model. You cannot do it with a person. You cannot do it only with resources. It has to be the combination of what we've been talking about today.
Thank you very much. And before I recognize Vice Chair Varner, I wanted to thank our witnesses for introducing me to the Equity Atlas. Thanks for that link in your written testimony. That's an extraordinary site. You know, you could just spend weeks and weeks going through that information. Vice Chair Varner.
That was a perfect introduction to what, I just have a comment, and this is for you all and for staff. With regard to your high road training partnerships and the information that you need for that, several months ago, we conducted a study on GIS in California and how it can be utilized more efficiently. And I think going back and looking at that study, I think that the information that from cross-agency in California that could be gained from a robust GIS system could be helpful in targeting some of this information that you need on a regional basis.
Thank you. Commissioner Beyer, I see your hand.
Yeah, just want to plant a seed for future consideration. If you use the federal government as a laboratory of democracy, kind of a reverse of the normal Jeffersonian concept, there are 2 things the federal government has done well in the last 5 or 10 years. One is race to the top in education, whereby states could submit for extra money if they met certain criteria on education reform. And you combine that with economic prizes, not just giving grants, but creating competition where there's a pot of money for the best proposal. It tends to be synergistic and adds participants from the private sector, from local government, et cetera. So if you were to have a competition for best regional education training programs with a prize of, I make up a number, $50 million, but only if you commit to meeting certain principles to apply, then you'd get hundreds of millions of dollars of new activity just out of the $50 million extra prize. So I think there's an opportunity to do what Assemblyman Quirk is talking about, but to try and leverage the money so that communities come together around winning a competition and getting the extra money, but they can't do it unless they're committed to doing something to begin with.
Thank you. Any other commissioners have any questions or comments at this time? Seeing none, I want to thank our witnesses for their testimony, the information they brought to us, and I think what I heard you say was we don't want it. What I put in my opening remarks, we don't want it to be just like before. We want it to be better, and we have a chance to make it better. And we've got some extraordinarily talented and dedicated people who share a vision about how to make it better. And it's going to be a challenge because it's always difficult to get people to change their behavior unless they see some immediate kind of reward for it. But what we're talking about, and I think what the commission is talking about, is we've got to harvest some immediate rewards along with the notion that things have to change in a lot of our institutions in order so that we can have it better than what it is that we've had before. I want to thank you both. Thank you very much. Tristan.
Thank you, Mr. Chairman. Our final witness this morning is Tim Rainey. Mr. Rainey is the Executive Director of the California Workforce Development Board, to which position he was appointed by Governor Brown in November 2011. Previously, Mr. Rainey was the Director of the Workforce and Economic Development Program at the California Labor Federation. He has also served as Policy Director for the California Workforce Association and as a consultant to the Senate Democratic Caucus of the California State Senate. He holds a bachelor's degree in government from California State University, Sacramento. Mr. Rainey, please.
Thank you, Tristan. Can everybody hear me okay?
Yes, I can hear you.
Oh, terrific. Thank you. Chairman Nava, I really appreciate the opportunity to talk to the Little Hoover Commission. I also appreciated your comments about the wedding and things that happen behind the scenes and how chaotic it can be. But you've got this great event coming off that is sort of belies the fact that it was complicated. I just did a wedding this weekend, and it went off without a hitch, but man, what a pain. And I also appreciated your comment about CETA. And if there's time to talk about the evolution of the workforce system, the federally funded workforce system, I'd love to. I know that Commissioner Arender, her and I've talked a lot about this in the past, and it's a favorite topic of mine. I think it actually explains kind of where we are today if we can go back a little bit in the past, but maybe if there's time. Jobs for the Future and Futuro are awesome organizations that I've worked with and watched a long time. So Tristan, terrific job pulling this all together. I hope that I say something interesting following those incredible presentations. I'll give it a whirl. I'm going to skip about the State Workforce Development Board, if that's okay, just in the interest of time. I can go back to that if folks have questions about how we're structured and why we exist. Our primary role, though, is a policy advisor to the governor on the Workforce Innovation Opportunity Act funding that comes into every state. Every state has a workforce development board like ours. We have 45 local workforce development boards around California that are very much structured the way we are at the state level, although our missions are different. We provide policy advice and policy direction on that local system. I'm going to start my video. Thanks for reminding me to start my video. Okay. We do the policy on the Workforce Innovation and Opportunity Act funding, advice the governor, but we also work very hard to integrate the broader workforce system. The WIOA funding that comes into California is pretty small compared to the broader investment in California in workforce education and training services. WIOA is about $500 million annually, 85% of which goes down to these 45 local workforce boards. The broader system that we talked a lot about today is about a $6 billion, give or take, investment annually. So it's much, much bigger than the WIOA piece. So we use the Workforce Innovation Opportunity Act as a lever to drive this system in the direction we think it ought to go. I want to talk specifically about the high road. Tristan asked me to come and discuss that. This is central to the work of the State Workforce Development Board under the guidance and great influence of the Secretary of the Workforce and Labor and Workforce Development Agency, Secretary Julie Su. Our attempt is to kind of turn the traditional workforce system approach upside down. Workforce development, I think it's been discussed, is primarily concerned with arming students or arming participants with what we believe they're going to need to be successful in competing in difficult labor markets, increasingly crowded labor markets, maybe clouded too. If a participant or student doesn't attach to a job or a good job, it's on that student or it's on that participant. President Obama used to call this train and pray. In fact, I think he used that when he signed the Workforce Innovation and Opportunity Act in 2014. So the workforce system, unfortunately, and we're trying to change this, is at the mercy of markets. And we try the best we can looking at labor market information to understand where markets are and where they're going to be. So really at the mercy of markets. The high road approach is interested and involved in changing markets and changing labor markets or labor market interventions, primarily using industry-based partnerships to change the way that workers are recruited, the way that workers are hired, skilled, upskilled, promoted, et cetera, so that we're not pushing people into labor markets as traditional workforce programs are involved in, but instead we're creating the conditions where we're pulling people into jobs from program, and not just any job, but quality jobs. So just a little bit more on the high road, and I'm really interested to get to the fantastic questions that I know we're going to be asked. I wish I could answer all the questions you already asked because they were fantastic. The high road is a set of principles that we apply to workforce, and we're applying it across the system now at the state level and at the local level and regionally. They're also broader and they represent the vision for a California that we want and a future economy we want, one that's based on quality jobs, equity, and economic justice. The four main pillars are quality jobs, worker voice, equity, and climate. Quality jobs, we start with the best jobs in industry sectors that are driving regional employment. So we promote companies in those sectors or employers that value workers not as a cost to be reduced, but as an asset to invest in. This way, we're actually subsidizing good employers, what we call high road employers, instead of a workforce system that's largely subsidizing the low road employers that don't pay good wages, that don't offer benefits, that don't have good scheduling, that don't put the worker at the center of the future of an industry or future of a company. Aida Cardenas, who just took over our high road work, I'll quote her because I think it's great. It really defines the work we're doing. The DNA of the high road is strong industry-based partnerships and deep industry engagement. So starting at the industry, again, with those companies in sectors that are driving regional employment, building those partnerships, upskilling and backfilling, and opening up opportunities at the entry level to move disadvantaged workers into good quality jobs, and then aligning the supply side of the equation regionally to pathways to those good jobs. So that's the part that's turning it upside down. You don't start with a program, you start with the best jobs, and then you pull people in. The second is worker voice. In the design and the implementation of industry-based workforce initiatives, workers often know best how to improve workflow, how to improve processes. They need to be able to co-design the future of work. If we don't allow workers to co-design the future of work, the skills training is not going to be right. What we understand are the challenges now and in the future for a company or sector aren't going to be right. And we don't address the anxiety of workers. If we don't have them at the table co-designing the future of their own jobs and the structure of work, it adds to the intense anxiety that workers are feeling and expressing today, expressing politically maybe, another conversation. Equity. The workforce development system, I think, is really good at equity. If equity is what we mean by that is removing barriers for populations who most need supports, the most vulnerable workers in our economy, in our communities. if it means removing those barriers so they have a leg up in those crowded labor markets. If that's what we might mean by equity, then the workforce system actually is doing okay. But it's not enough, because you can't have equity if you don't have job quality. Moving people into low-wage dead-end jobs, which is I think we do too often in the workforce system, is not going to change anything. Most poor people actually work. So this churning in and out of low-wage jobs cannot be the function of our public workforce system. We've got to do much better than that, connect people to a first job, a next better job, but at the end of the day, income mobility and income security, high road jobs. We currently have what we do at the state level, the State Workforce Board, is we obviously do policy, as I mentioned. We also do a number of demonstration projects, initiatives that are intended to inform the policy work that we do, but also to stand up initiatives across the state so we can say, look, what we've been talking about actually works. Check that out. So we've got a range of initiatives. One of them is the high road work that is informing everything else we do. We have 19 high road industry sector partnerships in just about every corner of the state. We've been funding this over the last 5 years only, so we're learning a lot. We've been funding it from the Workforce Innovation Opportunity Act funds that are discretionary to the governor. Prop 39 funding, we invested substantially substantially compared to the size of California, quite a drop in the bucket. SB1 funding we're using now, and greenhouse gas reduction funding to stand up these high road industry sector partnerships, example of the high road work I've been talking about. We have 8 of these in various sectors: hospitality in Los Angeles, building maintenance, goods movement, warehousing, healthcare, Kaiser, in fact, the Shirley Ware Center that works on behalf of Kaiser and a lot of other healthcare providers, mass transit across the state, the public sector, and utilities. We are in the process of completing requests for applications now. This is the Greenhouse Gas Reduction Fund. So we're going to expand those 8 high road training partnerships to 20. So in addition to all of this, we have construction centered high road training partnerships. We call them high road construction careers, and they really are in every corner of the state. And that's lining up community-based organizations, schools, workforce boards, and building trades councils to create access to the best jobs in the construction industry for people who otherwise wouldn't have had access to those incredible jobs. I want to leave it there just in the interest of time, if that's all right. I've really struggled on what I could say, and then I listened to all the other speakers, and then I got quickly overwhelmed with all the things I really wanted to talk about. So I think it might be best to open it up to a conversation, if that's okay.
Yeah, Commissioner Sidley has been patiently waiting, our distinguished lawyer.
Terrific.
So this actually maybe is more of a comment than a question. And, you know, Mr. Rainey, I'm at the Harbor Department, and Aveen Sharma says hello, and we thank you for all of your partnership. And I think that we are one of your examples. And I would also add that as we work to train employees and do this partnership, we also protect jobs from automation. If people are better trained and people go into a job immediately knowing what they are supposed to do, there's less incentive to try to automate. Clearly an issue for the Port of Los Angeles and our ILWU workforce, who is our partner every single day. So there are a lot of benefits to partnering and training outside of the actual job work environment. So we at the Harbor Department continue to be a partner with the PMA and our workforce and with you, Mr. Rainey, and the state. And so I just wanted to hold that out as an example of something that the Little Hoover Commission, if we need more information, can look at, because we are so focused on our training, and we have a new lashing training center, and we're very proud of it. And we're very proud of the partnership that we have with the state and with our employer and our employees. So thank you for your work. And I just wanted to sort of mention that for everybody.
Thank you, Commissioner Sidley. Commissioner Byer?
Thank you for your testimony. The tour that you gave us of what the state is up to was actually quite encouraging to me. I want to focus on small business. There are 4 million small businesses in California. As one of the earlier witnesses said, 40% are owned by women or members of communities of color. Oftentimes they have fewer than 10 employees. And I get how the state programs work for larger employers, whether it's the Port of Los Angeles or Google or Apple or some company that has hundreds or thousands of employees. What I don't really understand is how the state can partner with small businesses in an effective way so that those small business jobs are not dead-end jobs. And given the scale of the number of small businesses and their focus in retail and restaurants in the pandemic context, how can we make sure that there's a transition from jobs in that sector, those small businesses, into something more promising through the structure that you already have set up?
Yeah, that's such an excellent question. I think there are two ways I want to answer it, or try to answer it, Commissioner Beyer. The first is to acknowledge you're absolutely right. Most of the jobs in California are with small, medium-sized companies. And I think we spend precious little time concerned with how small, medium-sized companies are building talent. And I think that small, medium-sized companies really would benefit from a focus on joint industry-based development of talent that met their needs. Larger companies have the wherewithal. They tend to have the wherewithal to have large HR departments. They have the ability to invest in training. And they also have the ability to take advantage of the public workforce system, more so than I think small, medium-sized companies, because you have people who are dedicated to finding the dollars. One way of addressing it, and what we've worked on, we have some good examples in the state, is when you focus on a sector like manufacturing, for instance, which is actually dominated by small, medium-sized companies that machine parts or produce parts, contract with larger primary manufacturing companies. Those small, medium-sized employers tend to be contract-based. So they'll get a contract from a prime, either aerospace or biotech, what have you. They'll bring in workers. They'll recruit, usually using staffing agencies, and they try to meet the needs of the contract. When they're done, they let those workers go. So they've just invested in a workforce that they let go because now they're between contracts. And another contract comes along and they've got to go through the whole thing again. Working with staffing agency, it's a huge expense for small, medium-sized companies. What we'd like to build, and there are examples in other sectors, is to have medium-sized companies in manufacturing, for example, working with the primaries to co-invest in skills development, so that companies are actually taking the lead in investing in maybe regional skills infrastructure that allows workers to move from company to company more seamlessly. So workers don't lose ground, they get greater income security, but then the companies are actually investing less in total because they're investing collaboratively. And it was mentioned on a previous, I think the folks from GFF talked about this, and Futuro actually is doing this in real time, creating that intermediary capacity that can work on behalf of multiple companies to build that kind of structure around work that allows workers that mobility and allows companies to reduce their investment in training, but keep the workforce that they need. The building trades is probably one of the best examples, but we've seen it in healthcare in Los Angeles. We've seen it actually, we're developing at the Port of Los Angeles. I think it's a model that we're aspiring to. So small business, we need to figure out creative ways in how we restructure work and intervene in labor markets on behalf of companies, not taking away, but really providing value to companies. Heck, there was a second one, and I completely went out of my head, Commissioner Beyer.
No, I answered the gist of the question. The idea of an industry-wide collaboration, what I'm struggling with a little bit is in the context of retail and travel, tourism, restaurants, where the skills necessary for many of those jobs are kind of fungible. What's the tool the state could apply to help people move from those sectors into jobs that are in healthcare or in technology? And that may be a situation where the state has to work using revenue from its citizens to create certificates or other skills that are fungible outside the sector the worker is in. In other words, it may not be an employer-based training system at all. And the inflexibility or lack of timeliness in community colleges, the flaws in the for-profit training world, those are all impediments to those people being kind of locked into restaurant or retail jobs. And sort of how do we get out of that doom loop was really the gist of the question.
Yeah, no, I think it's a great one. It's relevant to these times. I mean, the pandemic has impacted the hospitality sector hardest and earliest. And in Los Angeles alone, I think 30,000+ workers were thrown out of work. And I think there are a couple of ways to get at that. One is figuring out how to move workers through retraining and collaboration with other sectors from one to the other. We had some early success in working with grocery, which was under a surge of workforce need, and still is, both in the distribution, but also in stores. Moving workers from hospitality through training in collaboration, both on the industry side, on the labor side, through a labor exchange, a web-based labor exchange mechanism, which was really good. You can do this kind of work if you've developed good relationships inside those sectors, and you've got labor management or government and business partnerships already built. These kinds of things become a lot more doable. Building them on the fly to meet the current crisis is much more difficult. So I think we have to think both short-term and long-term on that. On restaurants, there's a really interesting model that we invested in called High Road Restaurants. And it's work.
You froze, Mr. Rainey. Just hang on a second. It's got to get caught up to you. Yeah, it looks like he was disconnected.
Mr. Rainey, I don't know if you can hear us. Mr. Chairman has come back into the meeting.
He's probably going to have to log back in.
Perhaps.
There he is.
I see his frame. Don't go away because Commissioner Buisa has some questions.
Just one.
Mr. Rainey, are you able to hear us?
There he is. Yay. Welcome back. You're muted. We can see you, Tim, but you're frozen. You're just about ready to put your earbuds in.
We lost him.
I believe we have lost him.
No. Tim's back. Yay, we see you.
Yeah, I apologize. It seems I've gotten into a pretty tough Wi-Fi situation. So I apologize if I bounce off again. So great question. High Road Restaurants, I could talk about it more if there's more time. And if I don't pop off because my Wi-Fi is terrible.
All right, well, Commissioner Buisa, we've all been waiting for your question.
Right, thank you. Thank you, Tim, for your testimony. Workforce development and WIOA implementation is such a broad topic, and I know that we can't possibly cover all of it. And my question is very specific to the composition of the workforce development boards. And specifically to, correct me if I'm wrong, there was a previous requirement to include CBOs and workers in terms of representing state and local boards. You know, as a civil rights advocate, my assumption was Julie was going to, start going in that direction. It's primarily because from where I sit, when they don't have a voice in what, how much, when, and how they receive training, they face lesser security and greater difficulty in accessing the trainings and jobs that they need. So I'm just very curious, where is the system moving in terms of having more worker representation and CBA representation in local boards?
Yeah, two quick answers to that question. One is, the first is that local workforce boards are required by federal law to have community-based organizations on. It's built into the composition requirement. They're also supposed to have 51% business and organized labor in addition to community-based organizations. I think importantly, we at the State Workforce Development Board have been pushing workforce development boards and colleges to pull CBOs in as part of an integral part of the workforce system, and not on this sort of on the periphery. Most of the really mission-driven CBOs have very little resources. Those that are really kind of they're really centered in their communities. They understand the communities they work with best. And so we've been investing in AB 1111 is one way, in community-based organizations to better connect and align to the primary workforce development system. And that's going pretty well. I think what happens too often is workforce development boards and colleges, even when their intention is to bring CBOs in, they at the end of the day, they cut them out. So the way we approached it is we said, give us your budget. This is the part of the grant process. Give us your budget. We want to see the line item where you're actually giving, you're providing resources and dollars to the CBOs that are part of your partnership that is connected to the role that they're playing in the initiative. So we've been really deliberate about making sure that the CBOs not only are part of the system, but they have the resources to do what they need. And we've had great success with CBOs, especially on the pre-construction work.
Just a very quick follow-up. In relation to immigrant workers, where is the system moving in terms of being more inclusive of the big number of immigrant workers that we have in the state, regardless of immigration status? We know that this population really have a deep need in terms of reskilling, or whether it's portability of their degrees, etc. Where is the system in that?
Improvements need to be made. We have again invested specifically in immigrants. Actually, Commissioner Ehrener was involved with this early on. We keep doing this. So we have grant monies that are specifically focused on immigrants and immigrant integration through workforce development boards in collaboration with community-based organizations. But for all of this to work, again, I go back to the connecting the program work and the interventions to good quality jobs, because the most vulnerable people in California, the most vulnerable workers are immigrant populations, and they tend to be concentrated in low-wage jobs that are most vulnerable, and in fact, to the current crisis. So we need to be focused not just on employment and again pushing people into labor markets, but connecting to good quality jobs. So immigrant integration is a very, very big focus. The WIOA funds, federal dollars, don't allow us to serve undocumented workers. But we've put out guidance for local workforce development boards saying there's a lot you can do with undocumented workers before the federal government will get you in trouble. And we've done this all legally, so we're okay. But for our state funded funds, we are very deliberate about making sure we serve all workers, including undocumented workers, because they're part of our communities and they're part of our society, and we have to do well by them. So it's very deliberate from the state and at the local level. I hope that answers it somewhat.
Thank you.
Thank you.
Thank you, Commissioner Bouie. Any other commissioners who have questions or comments? Seeing none. I want to thank you, Mr. Rainey, for giving us so much of your time and for bringing us so much information. And it's really nice. It's nice and well, and it's helpful that there are examples that we can look to of the work that you're already engaged in as models that we can plug into some recommendations as we further develop our work. Thank you very much.
Absolutely, my pleasure. Thank you. Honored.
All right. Thanks for joining us. Now I think, Mr. Rarick, is this the part where we take a look at public comment?
We do, in fact, Mr. Chairman. So we will now move to public comment. I'll remind members of the public who are on the call that if you wish to make a comment, and I'll ask the staff to put up the screen with these instructions, you can either raise your hand in the Zoom. You can use the raise hand function in Zoom if you're on Zoom to indicate you'd like to make public comment, or you may email us, especially if you've phoned in, you may email us at littlehoover@lhc.ca.gov. That address is on the screen now. Please indicate your name and the number from which you will be calling so that we know who to unmute. In keeping with the Commission's normal practice, public comment is limited to 3 minutes. So please limit your comments to 3 minutes. So I'll give everyone just a moment. Either raise your hand or email us at littlehoover@lhc.ca.gov. Ashley, do we have anyone who has indicated using the raise hand function?
No, we don't have anyone on Zoom that has indicated they want to make a public comment.
Okay. And Rachel, can you let me know if anyone has emailed?
There are no emails.
Okay. Okay. I think, Mr. Chairman, since we also gave those instructions at the start of the meeting, we can assume then that we have no public comment.
Great. All right. Thank you very much, Mr. Rarick. So there's no public comment. We've heard testimony from our Mr. Varner.
Yeah, I just want to make a quick comment and just reiterate what some of the other commissioners said. This staff memo was extraordinary. It really set forth the issues really well, and I was really impressed by it. And I was, it really was digested a lot of the conversations we had over time, and as well as summarize some of the testimony we're going to have. So I just really wanted to thank staff again for preparing us very well for this hearing. And also, you know, Commissioner Beyer made a reference to, in the memo, there was a reference to a Rube Goldberg contraption. And I just wanted to state that when I saw that quote, I immediately went to the annotations expecting to see David Beyer's name by that, but unfortunately it was not.
Well, thank you. And I should mention, Mr. Vice Chairman, the credit for the memo goes to Tristan, who wrote it and did an excellent job. So I agree. So the credit goes to him and certainly not to me.
Again, thank you very much, Tristan and the rest of the staff. Ethan, did you have something else?
Mr. Chairman, I just wanted to, I'm cognizant of the time that we're just about to the 2-hour point here, but I just did want to briefly, before we adjourn the meeting, mention to the commissioners the upcoming meetings and the fact that we expect to have several reports to them. We will be meeting with the subcommittee on this topic to develop a report based on these hearings. That subcommittee is Commissioners Varner and Beyer, so we'll be meeting with them as we have been to develop a report on this topic. Our next meeting is 2 weeks from today, Thursday, October 8th at 10 a.m. We expect to have 2 full reports pending commission approval at that time, the final labor trafficking report and the report on voting equipment security. We are working with the subcommittees on those. We have a subcommittee meeting actually on voting equipment security later today. So we'll be meeting with subcommittees, have those 2 reports to the commission. We will then have 2 additional hearing dates in late October and early November, and then there's a November 19th business meeting at which we expect to have 3 reports go to the commission for full commission approval. Intimate partner violence, the first report on the economic recovery effort, and the biennial report summarizing the commission's activity the last 2 years. So we expect to have 2 reports come to all of you on October the 8th, 3 reports to all of you on November the 19th, and of course we'll be releasing those once they're approved. If they're approved, we hope they'll be approved by the full commission. So next meeting is 2 weeks from today, Thursday, October the 8th at 10 a.m. And the principal topics there will be commission approval. We'll be seeking commission approval of the labor trafficking report, final labor trafficking, and the voting equipment security report.
Wonderful. Thank you very much. Again, thank you to staff. Thank you to my fellow commissioners. I thought that was a tremendous meeting. Really appreciate all the work that went into it. Please, all of you, stay well. And I suspect we'll see you again on the 8th of October. Thank you. Bye-bye, everybody.
Thank you very much, Mr. Chairman. Thank you.